Hi, my name is Emil Euaparadorn. I'm a physical therapist at the Aspire Center for Health and Wellness out of New York City in Manhattan. Today, we'll be discussing a proper sleeping positioning. It is absolutely vital that you understand how to sleep properly, because if you are waking up with pain, that means for 6 to 8 hours at night, you're actually causing structural damage to your spine. And then in the morning you're stiff, you're trying to recover from your night before. It makes it very difficult to heal, because that's the equivalent if you were to like sprain your wrist. Like, and every time you do this, it hurts, right? And obviously if this hurts, what do? You stop doing this motion, right? Because it hurts, right? But let's say at night you go to sleep and you do this all night, you would never get better because you cause constant damage. So the key is to stop the constant damage. Sleeping is vital, because a proper night's sleep leads to increased healing. That's when most of our healing occurs, is at nighttime. So that's why you have to learn how to sleep in a proper positioning. So the main goal is a very simple concept. You have to keep the spine straight. So here's a spine right here. If your spine is twisting all night, you're pulling on the ligaments and the muscles. Right? If you're doing this all night, you are putting a lot of stress to the ligaments and muscles. And it's hard to heal once again. So let's discuss proper sleeping positioning. The first one is sleeping on your back. So Dwayne, can you lie down on your back, head over here. Okay? So right there, okay. Okay, legs down. So this is a common example of an improper sleeping positioning. So I'm going to come over here to the head. The pillow here should never be underneath your shoulders. What it does is lifts your shoulders up and causes this forward position, which we do all day with the computers. Okay? So you want this underneath the head. Now, this space underneath the neck here, I should not be able to feel move my hand underneath here. That means your neck is not being supported, and with time, gravity is going to push on your neck and cause more pain to your neck. So what you have to do is called the scoop method. The scoop method over here supports the neck. Okay. The next thing here is the lower back. Move your hand over here. If I can put my hand underneath your lower back, that means you have no lower back support. The harder the surface, the less back support you get. So you want to know how to kind of fill this space, which is kind of hard to do. You have to do it just correctly. So instead of filling the space here, you bend the knees. The more you bend the knees here, you see that it's harder to put your hand here, because you're tilting the pelvis and you're moving the spine and you're supporting the lower back. But it's difficult to do this all night, so it's better to actually get a couple of pillows. You put one pillow, you scoot it all the way to your buttocks region. The other one over here, can you lift up a little bit? And you kind of stagger it, and then put your legs down, okay? And you should feel totally relaxed. Okay. If you still feel space over here, that means we need more pillows over here. Okay? So this is how you sleep on your back. Now let's discuss sleeping on your side. Dwayne, can you face the camera there? Okay. So keep lift up over here. Alright, so this is an improper technique once again. The pillow should never be underneath the shoulders, so just get rid of that. Number two, your head should be straight, right? You can see that Dwayne's neck is totally tilted. His head should be straight, right? So you have to get a right amount of fluffiness in your pillows, okay? And once again, the space over here is not being really well supported, so you have to scoop up and then put your head down. Dwayne's neck is still tilted, so I would need another pillow over here, okay? Next thing, your shoulder blades, right? They actually, a lot of muscles connect to the neck. So if you have neck problems and your shoulder blade is doing this, it's pulling on your neck. Or if you have lower back problems and it gets aggravated by twisting, moving your shoulder blades will aggravate it. So what you should do is really hug a pillow. When you hug a pillow like this, it prevents you from rotating. Okay? Finally, many people have probably heard putting a pillow between your knees. What it does, it makes your leg heights even. Some people's knee would drop like this, and your pelvis will come and twist your lower back. This will prevent that. I would like to make sure the pillow is underneath the ankle and knee, because if it's only underneath the knee, you still get a twist at the hip. Okay? So you see, using two pillows here, or using one long body pillow will be a great addition as well. Now, one thing you see me I have not mentioned is sleeping on your stomach. Sleeping on your stomach is usually not advocated because you really arch your lower back, and if you sleep on your stomach, you can't breathe, so you have to turn your head, so you're really twisting your neck. So usually those who like to sleep on the stomach like having a sensation towards the front part of the body, so you could also use this approach over here, okay, and then turn towards it, okay, and you still have that surface being brought up to you, right, without twisting your neck in a full 90 degrees and without arching your lower back. Okay. So a common question people always ask is, there's no way I could do this. I toss and turn at night, and that usually the reason why we toss and turn is because we're uncomfortable. Once you find the right position, then you'll toss and turn less. In the beginning, it's going to take some time to figure out the pillow positioning and placement. Usually, nobody gets it on the first couple of nights, so you have to bear with me and try it and experiment with different pillow positionings. Even if all that doesn't help, that usually means that you're very, very stiff, and then your therapist should talk to you about a stretching routine you should do right before you go to bed. That way you make sure you wake up with pain-free motion. Okay? Alright, so once again, my name is Emil Euaparadorn. I'm a physical therapist at Aspire, and we just finished discussing proper sleeping positions.